Selamat datang di Uta Bicara, talk show-nya Uta 45 Jakarta. Ruang berbagi masalah terkini, menjelaskan informasi dan temukan solusi. Oke teman-teman, selamat pagi. Di sini kita udah bersama dengan Prof. Zaheer dan Prof. Diana Laila R. Nah, kedua profesor ini atau guru besar ini itu membidangi di bidang farmasi klinis dan juga farmasi praktis. Hari ini kita akan tanya-tanya lebih lanjut mengenai apa sih farmasi klinis dan farmasi praktis itu seperti apa di dunia internasional ataupun lokal di Indonesia. Oke, good morning Prof. Zaheer, Prof. Diana.
Good morning.
Good morning.
Okay. How's your day?
Yeah, it's been good. Thank you.
Okay, Prof. Zaheer, for start our podcast today, I will ask to you, what is the global and local challenge that's faced in pharmaceutical clinical and pharmacy practice in local and global?
Thank you very much for this question. I think the challenges, as far as we know, the pharmacy practice, I think the biggest challenges we have is that people do not use their medicines properly. I mean, the global studies we have seen that around, even if you buy expensive medicine, 50% of the people, for example, there are studies in United States which says 30% of the people, they just use their medicines properly. The others do not. So I think this is one of the biggest challenge we have, that people need to take their medicines properly. So medicines compliance, concordance, these are the major issues. So you're spending huge amount of money buying medicines, both in public and private sector. But if you don't use your medicines properly, then that's the issue. So I think this is one of the biggest challenge, that to train pharmacists, to educate patients on that. Yeah.
Okay, then Prof. Diana, how about your opinion about the challenge in pharmaceutical practice and clinical pharmacy?
I agree with Prof. Zaheer about the nowadays people don't use medicine properly, and also it's also big challenge to the pharmacists to educate people and to inform people about the medication. Sometimes people don't trust about the medicine. They go to the herbal medicines, and or maybe they think better for them to not take the medicine. So another point is collaboration between the clinical pharmacy, practice pharmacy with other medical team to make the medications good with the patient, because they need to have good communication, good collaboration for the patient's treatment, I think. So.
Okay, then I will ask to Prof. Zaheer first. In your opinion, Prof. Zaheer, how can pharmacists take on a more proactive in improving patient outcomes, especially in low resource areas?
I think what we see from, especially in high-income countries, because we see that the pharmacy practice is very much developed and advanced.
Yes.
And one of the reasons is that actually governments spend a lot of money. And I'm going to talk about in my talk as well that, for example, in Australia, government spend a few $1 billion to provide pharmacy services or give funding. The same way in New Zealand and UK as well. The problem in low and middle income countries is that there is no support there is no funding for the pharmacist. For over 100 countries, there is no funding. So the pharmacists basically survive by selling medicines and from their profits. So that's why the range of pharmacy services differ from one pharmacy to another pharmacy. So those pharmacists who are very enthusiastic, they try to provide services. Those who are not enthusiastic, they would not. So, and again, that what can drive them, it's about the use of medicine, because you see people are now living longer in every country around the world. And when you become 50 or 60, people are on multiple medicines. So when you are taking 4 or 5 medicines a day, the numbers are increasing. So it means that there is opportunity for the pharmacist to actually talk to the patients and give them proper guidance. And as I said earlier, even in high-income countries, 30%, 40%, these are the numbers where people use medicine. These are the people very educated. When we talk about low and middle income countries, as Prof. Diana said, there are misconceptions about modern medicine. People go for traditional medicine. And now traditional medicines and some traditional medicines are not standardized. So which makes it a little bit difficult, you know, sometimes they may be harmful. We don't know, you know. So I'm not saying all traditional medicines may be good, but they need to be standardized as well. So I think there are issues where pharmacists could play a very important role in contributing.
Yeah, I think Prof. Diana is agree with that.
Yes.
Prof. Diana is the vice rector in UTA 45 Jakarta. So I want to ask about the education and competency building. Nah, what are some essential competencies or skill that every clinical pharmacy student should have before entering the healthcare workforce? And how should universities adapt their curriculum to meet these needs?
Okay, I discussed actually with some college in medical doctor and then some of director of the hospital. The main competency the pharmacist should have is the knowledge about the medication and the drugs, because they are the expert one. Doctor doesn't know about pharmacokinetic and pharmacodynamic. The doctor doesn't know about the exactly drug interaction between one drug and another drugs. And then doctor doesn't know these few drugs will impact to few things or few organs in our body. They doesn't know exactly like what we have learned in our class. So that's why the first competency they should to know, they must have the capability about the medication. They should know about drug interaction. They should know about pharmacokinetic. They should know about the pharmacodynamic, and they should have capability to collaborate with doctor and give advice and idea if these drugs cannot be to these patients, and what is the drug is giving complication to the patient, what is the solutions based on the medical record of the patient. So this is, I think, the main basic thing that pharmacists must have, I think.
Okay, and in this situation, I think clinical pharmacist is on the way to the digital future of clinical pharmacy. I will ask to Prof. Zaheer. What do you think about electronic prescribing, then telepharmacy? What's your opinion about this situation?
I think it's fantastic, and I think this is going to be the future. Because you see, at the moment, the consumers you have, the people, general public, they are very well informed. You have now artificial intelligence, you have ChatGPT, you have Grok. People can just search anything on the computer or on the mobile phone, and they can have all the information resources. So I think electronic prescribing is wonderful, teleconsultation is wonderful. This is happening in many developed countries, and I see this is going to happen in low and middle income countries as well. And it's easy. And on the other day I was actually watching a video that someone was supervising a remote surgery. The surgeon was sitting in one country and he was supervising the surgery in another. So this is going to be the future, because we see the advancement in technology, but also we see the consumers which are becoming very intelligent. So the patients who are coming to pharmacies are not like 20 years ago. They have mobile phones, they can search everything. They can search even, drug interaction. But I think still there is a possibility and capacity for the humans to be involved, because even you have information overload. You have so much information, but which information is right and which information is wrong, that only a healthcare professional can inform you of that. General public may not have the ability to see what is right and what is wrong.
Okay, then Prof. Diana, should we add digital pharmacy into our curriculum, especially in Indonesia, to face the digitalization?
Yes, I agree with that, because if not, you are going to left behind. And then last week actually, I visit one hospital and one university. They make collaboration between medical and then digital, And what the result they are finding, actually they can they know exactly before 3 hours the golden time of the ICU patient, sepsis patients. They know exactly what the medication they should give to the patients. It's going to help patients so much and going to decrease the mortality among ICU patients. So digital help. Then I agree with Prof. Zaheer also that with the digitalization you need to be smart which one correct information and which one incorrect information also.
Okay. I have a last question for our professors here. To Prof. Diana and Prof. Zaheer, do you have any suggest or advice to next generation who will join to clinical pharmacy workforce? I think from Prof. Zaheer first.
I think my advice is basically to look for the evidence, because many of the things which we do will be based on research. So the strong research will build the foundation to produce the evidence, and then this evidence can be used for practice. So to look for good research which can be used. So this is my advice for the generation: do not just look for the weakest study, look for stronger studies which you can use it.
Okay. How about Prof. Diana?
My advice for the next generation, for the young pharmacists, be competent with your area, and then be knowledgeable, and then you must be master with the medication, because that's the basic thing you need to have actually. That's all for me.
Okay. Sorry, one last question. Prof. Zaheer and Prof. Diana, can you share one word about clinical pharmacy? Only one word from Prof. Diana, maybe?
Clinical pharmacist, actually, medicine.
Medicine. Okay. How about you, Prof. Zaheer?
Patient care.
Patient care. Oh, I think that's two words, but it's okay.
Then patient, perhaps.
Patient.
Yeah.
Okay, so thank you, Prof. Zaheer, Prof. Diana, for coming to this podcast. I hope this podcast can share insights for young pharmacists like me. Jadi gitu teman-teman, kita udah diskusi banyak terkait farmasi klinis dan juga farmasi praktis, terutama di dunia global dan juga di Indonesia. Oke, jadi terima kasih udah nonton Uta Bicara, talkshow-nya UTA 45 Jakarta, ruang berbagi masalah terkini, meluaskan informasi dan berbagai solusi. Jangan lupa like, komen, dan subscribe. Terima kasih, dadah.